Good afternoon, Victoria County. Today we have Dr. McNeill, our Public Health Authority, who will give an update on COVID-19 in Victoria County and discuss the importance of accurate information and data in making decisions related to COVID-19. As of today, we do have 6 new cases, bringing our total to 127, and unfortunately, we do have 1 new fatality to report, which Dr. McNeill will speak a little bit more to in just a minute. Victoria's new Stay Safe, Reopen Responsibly order is in effect. This new order does require businesses to have their employees that have contact with the public to wear a facial covering. Again, these coverings do not need to be surgical or an N95 mask. A cloth face covering, such as a bandana or scarf, will work. We have also posted on our Facebook page some tutorials for DIY masks. We also are strongly recommending that all individuals can safely wear a facial covering and that they do so, that all individuals that can safely wear a facial covering do so while out in public. And we've also gotten some questions from businesses asking if they can require their customers to wear a facial covering. The answer to that question is yes. Similar to how they can regulate no shoes, no shirt, no service, if businesses feel it is within the best interest of their business and staff, they can require the general public to wear a facial covering before entering. I'll now turn it over to Dr. McNeill.
Good afternoon. Thank you, Caitlin. First off, let's, I do have I have a bunch of stuff here. I do want to talk about that one new person that we talked about. Excuse me. Victoria County Health Department is reporting the death of a Victoria resident of a patient who tested positive for COVID-19. The patient was a Victoria County resident in his 60s that had been hospitalized here in Victoria. To respect and honor the family, no personal information will be released. I actually was given this information about 2 minutes ago. It's unfortunate that our county has lost one of its residents because of the spread of this virus. The Victoria County Public Health Department, as well as the rest of our emergency management team, certainly extends its deepest condolences to the patient's family and friends. So, looking at the case count a little more in depth, we do have 6 new cases that we're reporting today. So 6 new cases. That brings our total up to 127 patients in our county. We do have the total now of 3 deaths, which includes the one that I just mentioned to you. The good news is that we have 77 patients that are considered recovered, and we have active cases of about 47. We still have about 12 patients hospitalized, but only a few of those are in intensive care units, so that's good. Actually, there's only 3 in the ICUs. The PAM outbreak, remember we've talked about that. PAM North had 44 patients. PAM Southeast is up to 14 patients, with 10 of those being residents. So those are our numbers. We update those every day, and we'll continue to update those for you. One of the things that I do want to mention, there's just a few things that I want to go over, and then we'll talk about, and then we'll have questions. So if y'all have any questions, I'll be glad to try and answer them for you. The CDC has recently but they've just added some things as far as symptoms of this disease. And we all know, and most of you have seen those, but this is an ever-evolving thing, and every day we probably learn something new about this disease and the way that it acts and what it does to humans and the bad little things that can happen with it. So when we look at that, they have come up with some more symptoms, and these are symptoms that are based basically on what healthcare practitioners have told them that we're seeing. Probably one of the most interesting things is the loss of taste and smell. And we've seen that, and I've seen it with patients that have came in, and they actually report that they've lost their sense of taste and they've lost their sense of smell. This can be a devastating thing. It usually returns, but it's not been uncommon with COVID virus. So that's something that sends up a red flag to a physician or a practitioner when they hear this. The other things that they've added are things that we pretty much already knew, as far as chills and repeated shaking with chills, or the medical term for that being rigors. So we see people that are just shaking, and patients come in and say, I just couldn't stop shaking and I've got this fever, and these are things that we worry about. So these are symptoms that go along with COVID, with the COVID virus. The muscle aches and pains, headache, sore throat. These are some of the other ones that they've added to the list, but these are symptoms that we've seen. And that just kind of exemplifies how this disease goes. I mean, we're learning about this, and I want to talk to you in just a few minutes, and I want to talk to you about the flu, and I want to talk to you about COVID. But this is one of the things that we know from the flu, and we know the flu because it's been around for a long time. It's been around for a long time, and we've been able to look back at this. You have to understand that COVID has not been around a long time. Coronaviruses have been around for a long time, but this is a different virus. I mean, it's a coronavirus by definition, it is. But it behaves differently, and it does different things. So with that, let me see. One of the things I want to talk about today is I've seen some nationwide stories, and a lot of y'all have probably seen this, and I hate to even use the term going viral, but they have gone viral. And the thing is that there are people out there that are basically saying that this disease is similar to the flu, and that this disease is like the flu, and we need to treat it like the flu, and we don't shut down America for the flu, so why are we doing it for this? I'm going to be a little opinionated, but I'm going to be opinionated based on data, okay? And I'm going to be opinionated based on things that I've seen, and I'll be opinionated based on things that I've seen from some of my friends that are taking care of these patients more than I do. And I have colleagues and I have acquaintances and friends that are literally in New York, and they're taking care of these people on a regular basis. And trust me, COVID virus is not the flu. It's not the flu, folks, okay? It really couldn't be any further from the truth. And I'll tell you, there's a lot of things I can tell you about this, but I'll tell you just a few. Probably the biggest difference between these viruses, I mean, we know that influenza is a virus and COVID is a coronavirus. They're both viruses, so they do have a lot of things in common. They work the same at the cellular level. They go in and they take over your cells and turn them into little virus factories. And that's what happens. That's how a virus takes over the host. And it takes over enough of the host until eventually the host can no longer survive. And that's multiple organ failure, and that's what people die from. But this disease is different. It does different things than what the flu does. It does a whole lot of different things. And one of the biggest things that it does is, and I'll just, let's speak to something that we all know about. Let's talk about what happens when you get the flu. There are people that are listening and the people that are in here in this room that have had the flu. And you know how you feel. You feel terrible. And what do you do when you feel terrible? You probably stay home and go to bed and have a fever and take Tylenol and Motrin, but you don't go out and you don't spread it as much. Some people do, and that's how it spreads. Droplet theory, the same as coronavirus. Here's the thing about this coronavirus, about this COVID virus, is that you can get it, you can have it for several days and shed virus and not even know it. Some patients can have it for the entire course of the disease and continue their normal activities. But what are they doing? They're spreading the virus. This is scientifically backed up, and this is what I'm talking about as far as real data, is that the average person with the flu will give it to about 1 to 1.3 patients. The average person with coronavirus will give it to anywhere from 2.3 to 2.5 to even higher number of people. So that right there is exponential growth. And I've told you all those numbers, how they grow. And just a few small changes in the bottom number there makes a difference when it's gone through 10 cycles of different people and different spreads. So that's one of the biggest things that we're going to see with coronavirus. So what has helped that? What has helped that? Social distancing. But just the fact that we've done social distancing is another reason that we can't compare flu to COVID virus. Because when you get the flu, we don't do social distancing. We don't shut down the mall. We don't quarantine nursing homes. We don't do those things, even with the H1N1. And I remember I was working in the urgent cares and in the emergency department full time when H1N1 flu came out. And it was bad. It was terrible. But it wasn't as bad as this. So when we get back to social distancing, it's kind of hard to compare these two diseases when we have basically done completely separate and different mechanisms to try and prevent the spread. We've shut this country down, for lack of a better term, to prevent the spread. So that right there means you can't compare the two because you're comparing apples and oranges. So there are a lot of other reasons and a lot of other things we need to think about. Let me tell you this. The flu puts about 2% of the people that get it in the hospital. COVID virus puts between 18 and 20% in the hospital. The data from New York tells us this. If you get put on a ventilator, out of the 5,700 people that they looked at in this last study from New York, 88% of those people died on that ventilator. I can tell you right here and now that flu doesn't do that. And we're talking about 18% of the people, 18 to 20% getting hospitalized with COVID and 2% with the flu. So for the lack of me, and this is where I go into my personal opinion, I don't see how anybody could compare this to the flu, because they're not different. They're not the same. They're not the same. And COVID is much worse. And we've done the right thing. We've done social distancing. I'm looking around at a bunch of people right now that are wearing masks. I wear a mask. Now, we're going to start opening up. That's good. We've got to, because we have to. But we have to be careful, and we have to do it right. So let the record reflect that if you ask Dr. McNeill if the flu and COVID virus are the same and should be treated the same, the answer is no. Okay. Enough said on that one. A couple other things that we wanted to talk about. Remember that regardless of what we call this disease or how we treat it, there's a lot of things that we still have to do. And I have to remind you of this because as your local health authority, it's my job to give you correct information. And what I'm telling you today is make sure that if you, even with opening everything up, when you feel sick, please stay home, okay? Please stay home. Practice social distancing, okay? We're going to open things up, but you still need to social distance. This may sound terrible, but when I go somewhere, I look at everybody as if they have COVID and they're trying to give it to me, okay? I wear a mask. I hope they're wearing a mask. I hope everybody wears a mask. And I hope that we keep the social distancing so we can get this reservoir down, this reservoir of this virus. Are we going to get rid of it completely? I don't think so. Are we going to have to social distance all summer? I think so. So we just have to do the best we can with that delicate balance between opening our community and let people live their lives and being safe. Frequently wash your hands. Minimize contact with people outside of your household. I'm not making these things up. These all come from the CDC, by the way. So, and of course, wearing the facial mask that we always talk about. One other thing I will tell you is that our community is opening back up, and I will tell you that this week our hospitals have started doing their elective surgeries. Now, I heard an interesting thing earlier today, and I wanted to share it with you. When they're talking about elective surgeries, you think of an elective surgery as something elective. You can have it or you cannot have it. Well, a lot of these elective surgeries are for people that need joint replacements, say knee replacements. Well, they need a knee replacement because it hurts them so much to take a step. They can't walk. Their lives have been affected. I ran into a lady the other day at HEB that told me that her hernia repair is an elective surgery, but she has continual abdominal pain until she gets that fixed. So it is important that we do these things. And I'm happy to say that our hospitals are back doing these things. And I'll tell you what, our hospitals are being careful. Our hospitals are being very careful. Every patient that comes in for an elective surgery gets a COVID test. They're screened again the day that they're there. They have to have a negative COVID test before they'll go to the operating room. They're also even going so far as to do chest x-rays on every patient before they do that. And that's at both of our hospitals. Now, with the PAM outbreak, specifically, I can speak to this from Citizens Medical Center. I will tell you that that is being handled, and that is being correctly addressed. Trust me, it is. I've been on the phone with their administration, their chief medical officer, 3 times today. And I can tell you that our hospitals are safe. There's a lot of information out there right now, nationwide, and I'm sure that it pertains to Victoria as well. There are people that are doing worse with their established diseases because they're afraid to go to the hospitals. Our hospitals are safe. Our emergency rooms, our emergency departments are safe. We take precautions there. We see all patients. The worst thing that can happen is for someone to do poorly with another disease because they're afraid to come to the hospital because of COVID. And nationwide, heart attacks and deaths at home are greatly increased. The number of cardiac catheterizations for emergency patients having heart attacks is down everywhere. And I spoke to one of our cardiologists today that told me that it's like they're almost non-existent now because people are afraid. Don't be afraid to go to the hospitals. Our hospitals are safe. And don't be afraid to go to Citizens because of what happened there at PAM. That's being controlled, and everything is being done right. Okay. I don't have anything else. If y'all have any questions, I'll be happy to try and answer them.
Yes, Dr. McNeill, it sounds like you're talking about restrictions and social distancing and mask wearing, not only in the near future, but maybe in the potentially long future. It sounds like you were saying social distancing through the summer. How do you think our lives are going to be changing in Victoria County in the next year or even years? What sort of restrictions should we continue ourselves and through our local government?
The question is basically, John, is what's the future going to hold for us with our new way of life? You know, it's hard to know, and that's one of the things that the Centers for Disease Control has really talked about, and we're all looking at that, and we're all wondering what's going to happen. I got the information about social distancing probably for the rest of the summer from Dr. Burks. So she has given us that information, and that's what she thinks, and I don't disagree. I don't think I'd ever disagree with her, but I'm certainly not disagreeing with her about this. So the thing about it is that the new normal is going to be different. I'm not sure that shaking hands will ever come back. So, and that's a big thing. You know, when I was little, my dad taught me to stick your hand out and shake somebody's hand. But I'm not sure that that's the best thing to do anymore. So there will be a lot of changes. Right now, we just have to go with it. We have to do what it takes to keep us safe and to decrease this virus load in our community so that we can get back to a closer semblance of our life.
Dr. McNeill, what would you compare COVID-19 to?
The question is, what would I compare COVID-19 to?
Not the flu.
Well, it's not the flu.
Right, I know.
I wouldn't compare it to Ebola because I think that kills you pretty quickly. But I don't really know what to compare it to, and that's been a problem with this disease, is that it's so new. And getting onto that topic of being new, remember that the people have had flu for ever. The flu's been around, influenza's been around for a long time. And the reason it keeps coming around is because we see different strains of it. And you know, every year we vaccinate for the most common circulating strains. So with all those different strains around, your body has been exposed to a lot of different flu, and you have circulating antibody for a lot of different types of flu. And the studies are pretty clear. When a person gets the flu, if they've had the antibodies to another strain of it, if it's close, then you'll probably do a little bit better. That's the deal with the novel coronavirus. This is brand new. Your body has never seen it before. It's an enemy that we've never encountered before, and it's an enemy that your body really doesn't know how to fight. And that's evidenced by the numbers. That's evidenced by the death rates, which are increased regardless of what anybody says. They are increased. There are a lot of people saying that, well, we don't know how many people are going to be tested and have had it for a long time, so we really can't say. I agree with that because it's statistically correct. But I can tell you that every number you look at shows that the death rate from this disease is a lot higher. I didn't mean to go back into that topic. But for the most part, I don't think there's anything you can compare it to answer your question directly.
Dr. McNeill, I know you're extremely busy these days, but if you have been out in public, what have you seen? What kinds of numbers of people have you seen not wearing a mask? And do you think there are enough Victoria County residents wearing masks when they go into public? How can we increase that if it's not enough?
Well, short of a mandate like Harris County did, I'm not sure that we can increase it. I mean, we try and educate people, and we try and tell them that the best thing they can do for themselves and for everyone around them is to wear a mask. So I don't think it's a big deal to wear a mask. I wear mine. I hope that nobody has a picture of me out in public without a mask on, because if it was before this. But remember, this is changing. You're talking to someone that 3 or 4 weeks ago told you not to wear a mask. But the data's going to change, and we're going to adapt and change with it. As far as the number of people that I see, I don't think that I see enough people wearing masks. When I go somewhere, I think that even a few people not wearing masks is too many. So I would like people to wear masks, and I say that every time I get here.
Caitlin, I have a question for you. Any news or updates on the potential for masks being distributed for free anywhere in our community?
And no, not yet. But again, there are those tutorials for how to make them, even out of old T-shirts lying around the house that you have. I've made some with dishcloths. For my kids, I've actually cut out the sleeves from my husband's shirt, and they just fit right over their head to be able to pull up on them, just in case we happen to have to go anywhere with them.
Yes, ma'am.
I was just wondering about your opinion on, seeing these numbers, knowing that we still have potential for increase and second waves, and what Governor Abbott has just laid out for us within the last hour. What's your opinion about this? Because it's very, it's like seesawing. It's one thing to say, and I get it, why we're wanting to reopen. What is your opinion about it?
Well, my opinion from a local health authority and from a medical standpoint is that my number one concern is the medical health of everyone involved. But I'm not oblivious enough to understand that if people can't get access to health care and they can't get access to food and they can't live their lives or support their families, that they could lose their insurance, which could be catastrophic in some illnesses. They could not be able to afford the correct medications, and we all know that people die from poverty as well. So there is a balance in there. And I, in the beginning, I thought we just need to shut it down and leave it closed until it's gone. That's not realistic, and that's medically not realistic. Well, it's not realistic on any standpoint. We've got to find that balance, and I don't know of any other way to do it except to try and see what happens. Now, do we have a plan in place in case things go awry and the virus numbers jump up? Then yes, we do have a plan. So we'll go back, we'll regress, and we'll be better at it. But right now, I think that what we're doing is based on medical science, and it's based on economic numbers that I don't understand. But I think that it's the correct thing to do. And I'm not just saying that. I know there were some people that thought I really wasn't in agreement with that, but I am in agreement with that because I understand the big picture. And the big picture is that we need to be able to live our lives to some degree. Just don't call it the flu. All right.
Dr. McNeill, and more specifically, what does that plan look like if we do indeed have a resurgence? What sort of orders or recommendations might we see returned or whatever?
Well, I'm sure that it would look like exactly what we were doing before. We would just have to identify those things that we can do better at, and that being the things that will help us not spread the virus as much.
And I heard this question asked to Governor Abbott today, and I would love to hear an answer about what it would look like locally. What sort of demographics are we going to look at to determine whether we have a resurgence, and what kind of numerical threshold would that involve?
You know, there's not a really numerical threshold, I would think. I mean, my thought on this is more of an epidemiological type question, but my thought on that would be to look at the community spread and to look at this. And I've said this before, that if someone spreads the disease to a family member, we understand where it came from. If they can't identify anyone that they were sick and they've been around those, and we start to see a lot of those, then we're talking community transmission, and that's more worrisome. So that would be the biggest threshold I would look for.
Is that why contact tracing will be very important in the next months or whatever as we proceed into the future? And how might we see contact tracing increase locally?
Well, we're going to continue contact tracing, and our epidemiology team does a wonderful job at that. So we'll continue doing that, and we'll continue watching these cases. It's a lot more manageable when we have a few cases a day as compared to the 10 or 12 that we had for a few days. So they were really stretched at that point.
Maybe this question is better for Caitlin, but any idea when we might hear from our judge and our mayor about what sort of local orders we might see here and how they might differ from what the governor talked about today?
Yeah, so the governor came out, for anybody who didn't catch it, at 2:30 today and made an announcement that starting May 1st, restaurants, movie theaters, retail stores, and malls could open at 25% capacity. We actually haven't gotten our hands on his official document yet. His website was down earlier today. So the mayor and the judge, I know, are itching to get their hands on that, and will be studying it closely. So I anticipate maybe Wednesday, definitely by Friday, they'll be up here.
Okay.
Dr. McNeill, I recently heard out of Goliad County that one of their patients who had been reported recovered is now considered an active case again. Can you tell us, and also it was also theorized that another strain might have influenced that. Do you know anything about other COVID-19 strains and how someone might be determined to be an active case after they're recovered?
You know, it's hard to answer these questions with this specific virus because it changes. Now, I can tell you about a week ago, I read information that said that there were no other specific strains identified for the COVID virus. Now, they could have come up with 27 of them in the last week, so I really don't know. I don't think that there are any other circulating strains that we know of. And as far as that, as far as the specific Goliad patient, I don't have any information on that.
Got a question from a reader. Should couples who don't live with each other, and I assume they're talking about romantic couples, should they still discontinue contact? And should they still discontinue contact after May 1st?
That's an interesting question. And I really don't have a specific answer for that. I mean, I think that it would, it goes against social distancing. But I would honestly say that it would depend on how safe those people feel around each other. I mean, I certainly would look at what the other person did and where they went and things like that. And that's a hard question. I really don't have an answer for that one. So I know that the CDC recommends social distancing and wearing masks. So,
can you tell us more about your role in the decision making with the mayor and the county judge? Specifically, how would you reassure residents who are concerned that local decisions might be made at the expense of public health?
Well, I would not think ever that any decision that I would have anything to do with would be at the expense of public health. So that's the first thing. The second thing is, as far as the way that we do things, we meet every day in the morning, and we talk, and we go through things, and we discuss, and we go back and forth. Now, we don't always agree on everything, but we come to a consensus, and that consensus is always based on public health and the overall well-being of the county and the people here that we talk about. So it's that fine balance between economics and public health. So, but we work well together. We really do. And I can tell you that, and I'll reassure you that if there was something that either the judge, and I'll honestly tell you this, Sean, if there was something that either the judge or the mayor wanted to do that I completely disagreed with, I would tell them that, and I would tell everybody that I disagreed with it, because I feel strongly about what I do, and they feel strongly about what they do. And up until this point, and I think it will continue, we do come to consensuses and we do agree, and somebody gives a little, somebody gets a little. So opening things up, I may give a little, but I get masks in return. So we do things like that, and we work together, and it's worked out well. Now, I've seen areas where that doesn't happen, but we've been fortunate, and we're fortunate because we work hard at it.
You had said before that you were satisfied that Pam was doing enough to control the spread of the disease with its 2 outbreaks. Can you tell us more about what Pam is doing?
Well, I can tell you that they are doing everything necessary. They're working on their standards, and they're working on their procedures. That's the word I should use, their procedures as far as personal protective equipment. I know that they are screening these patients. I know that they are testing patients. They've been very forthcoming with that. They've given us all the information that we want. They've been community partners. They really have, and they understand that. And they understand that from the fact that they're in our community, and they understand it from a financial standpoint. So it makes sense for them to participate and for them to do what's right for this area, and they have, and they are. And I really believe that. I wouldn't just say that. They've been very open with me. I have the cell phone numbers to the CEO, to the chief medical officer. I can pick up the phone at any time and call them with a concern, and we can talk about it, and that's been nice. So that's a big corporation, and for one doctor in one city in Texas to be able to just call them up and talk to them, I think that says a lot to them. I really do.
Are you allowed to be more specific about exactly what they're doing?
As far as, they're doing what they're supposed to be. I mean, they're following CDC guidelines as far as protective equipment. They're making sure that they keep the patients where they're supposed to. They've done very well with the COVID unit out there. They're putting those patients there. If a patient becomes positive from COVID, they are moving that patient to that facility. So those are the things they're doing. They're doing the things that they're supposed to, but and they're following CDC guidelines, and they're following local health authority guidelines, and they're following our health department guidelines. So I'm not happy that they had outbreaks, but I can tell you they're very unhappy that they had outbreaks. So, but outbreaks do happen. We see outbreaks in other things. We see outbreaks with other diseases. We see outbreaks in other places. So we just kind of deal with them, and we do what's right to mitigate them, and we assume that they're going to be cooperative, and they have been.
And regarding this third death that we're reporting today, very sad news.
Yes.
But can you tell us more about when they were diagnosed, whether or not they had any pre-existing conditions?
I will honestly tell you that I was handed that press release. We were about a minute or two late, and that's because I was handed that press release. So all I know is that it was a male in his 60s, and that he expired from COVID.
If there's no other questions, I'll go ahead and close this out for the day. I wanted to thank you all for your time and tuning in today. Again, for those of you who missed it, we do have 6 new cases to report. That takes our total up to 127, and unfortunately 1 new fatality, and our thoughts and prayers are with the patient's family. For accurate information, if it's released on our Public Health Department Facebook page or on our website, victoriatxoem.org, it is accurate Victoria information coming directly from your local health officials. And our COVID hotline is still active Monday through Friday from 8 to noon and 1 to 5. And that phone number is 361-580-5796. This briefing will air tonight on Suddenlink Channel 15 or 115 at 6 p.m. Fox 19 will replay this briefing at 10:35. Following the closing of this briefing, a recording will also be aired on KIX, Q92, Jack FM, and Club stations. For anyone with unmet needs, we ask you to please call 211. And if you're in need of some mental health support right now, there is a statewide 24/7 hotline, and that is 833-986-1919. And as far as the governor's new guidelines he put out for reopening Texas, as soon as we get our hands on that document, we'll also post it to our Facebook page so you guys can review it as well. Thank you all for your time, and we'll see you again on Wednesday.